Hi and Assalamualaikum. Welcome back to Sex Hormone Part 2. Now we are going to proceed with progesterone. Progesterone is the natural of the progesterone. It is secreted by scopus luteum, testis, adrenal cortex in a small amount, and also placenta. There are two main preparations. First, naturally occurring hormone and its derivative. Second, the testosterone derivative like as testosterone with progesterone-like activity. Progesterone itself, it is not widely used as contraceptive therapy due to rapid metabolism. Progestin is a synthetic progesterone, are more stable, allowed lower doses orally. Here is the example of the progestin agent like a desogestrel, dionogus, drospirenone, levonorgestrel, and others. Okay, this is the diagram of the progestogen. The physiological effect of progestogen, it helps the development of the endometrium. It also develops the mammary gland during pregnancy, and it also helps in the milk secretion start when its level decrease with birth. The clinical usage of the progestogen are mainly for contraception and also hormonal deficiency. Progesterone also has been used for control of dysfunctional uterine bleeding, dysmenorrhea, management of endometriosis, and also infertility. The adverse effect of the progestogen, like headache, depression, weight gain, changes in libido, acne, hirsutism, and also hyperkalemia. Mifepristone is one of the antiprogestin. It consists of progesterone agonist with partial agonist activity. Mifepristone co-administration with prostaglandin analog such as misoprostol is to induce uterine contraction. The clinical uses of the antiprogestin, it can be used for abortion, which can interfere with progesterone and also decline in the HCG. Next is also being used for contraceptive agent. The adverse effect of the antiprogestin is the uterine bleeding and also risk of incomplete abortion. As hormonal contraceptive, it can be given together like a combination of estrogen and progesterone, or it can be progesterone alone. For the mechanism of action of estrogen, it provides negative feedback on LH and FSH release by the pituitary gland and prevent the ovulation. While the progestin or progesterone, it thickens the cervical mucus and hampers the transport of sperm. For the clinical uses, mainly it has been used for birth control and also for treatment of the polycystic ovary syndrome, endometriosis, amenorrhea, menstrual cramp, premenstrual syndrome, primary ovarian insufficient, and also acne. There are few types of combination of oral contraceptive, like a monophasic combination pills and also triphasic pills. For the monophasic combination pill, it consists of a constant dose of estrogen and also progestin, while the triphasic pill, it consists of a constant dose of estrogen and increased dose of progestin. And normally it should be taken for 21 to 24 days. Transdermal patch is an alternative with combination with oral contraceptive. It consists of ethylene estradiol and norgestromine or progestin. While the vaginal ring, it comes with the ethylene estradiol and also etonogestrel. There are few types of progestin. First is the progestin in a pill form. It consists of norethindrone, and also called as a mini pill. It need be taken daily. It delivers a low but continuous dosage, but less effective than combination products. While the progestin implant, it consists of a etonogestrel as a subdermal implant, and the adverse effect, it can make a irregular menstrual bleeding and also headache. For the injectable progestin, it consists of medroxyprogesterone acetate. It can be used via intramuscular injection or subcutaneous injection. The adverse effect would be weight gain, amenorrhea, and also bone loss. For the progestin intrauterine device, it consists of a levonorgestrel. It is highly effective for long-term contraception and patient contraindication with estrogen therapy. Lastly is the post-cocktail or emergency contraception, which is it consists of high dose of levonorgestrel, and it also consists of high dose of ethylene estradiol plus levonorgestrel. The adverse effect of the hormonal contraception, it can be determined by the specific amount and combination used, such as estrogen. It can affect the breastfulness, fluid retention, headache, nausea, and increase of blood pressure. While the progestin, it can cause the depression, changes in libido, hirsutism, acne, and thromboembolism, thrombophlebitis, myocardial infarction, and stroke. Okay, lastly, we are going to focus on the androgen. What is androgen? Androgen is a group of steroids with anabolic and or masculinizing effect in male and female. Secreted by testes, ovary in a small amount, and also adrenal cortex. Testosterone is the most important form of androgen. Other androgens secreted by testes are like 5-alpha dehydrotestosterone, androstenedione, dehydroepiandrosterone. The physiological effect of the androgen, it can cause a normal maturation in male, sperm production, development of secondary sex characteristic, increase the synthesis of muscle protein and hemoglobin, and decrease bone reabsorption. The mechanism of action of androgen, it binds to specific nuclear receptor in a target cells. The clinical usage of androgen, it is used for primary hypogonadism, which is caused by the testicular dysfunction, and also being used for secondary hypogonadism, which is caused by the hypothalamus or pituitary failure. Androgen also being used for chronic wasting in HIV cancer, anabolic effect like an anabolic steroid, where it can increase the lean body mass, muscle strength, endurance, and endurance in athletes and bodybuilders. Danazol is one of the weak androgen, which is being used to treat endometriosis and also fibrocystic breast. The adverse effect of this danazol, it can cause the weight gain, acne, decrease breast size, lifting voice, increase the libido, and also increase the hair growth. The pharmacokinetics for androgen, first we are looking at the testosterone. It is orally ineffective in the first pass metabolism. It available in intramuscular injection, transdermal patch, topical gel, and Parker tablet. Testosterone also rapidly metabolized, excreted primarily in urine. The testosterone derivative, such as alkylation of testosterone, allow oral administration. Fluoxymesterone, effective orally and have longer half-life. Oxandrolone, effective orally and better anabolic activity. Androgen adverse effect can be very depends on the consumer. Like a female, it can cause the masculinization, acne, growth of facial hair, voice deepening, male pattern baldness, excessive muscle development. For children, it can cause abnormal sexual maturation and growth disturbance. While for the general effect, it can cause the increase in the LDL, decrease of HDL, and also edema. For the male adverse effect, it can cause priapism, impotence, decrease spermatogenesis, gynecomastia, cosmetic changes as seen in female, stimulate prostate growth. For athletes that use the anabolic steroid, it can cause the premature closing of epiphysis of long bones, reduce testicular size, hepatic abnormalities, increase the aggression, and also major mood disorder. This can cause by the high dosage use of the androgen. For anti-androgens, it counter male hormonal action where the mechanism of action can interfere with androgen synthesis or by blocking their receptor. The agent can be like finasteride or dutasteride, which can inhibit 5-alpha reductase and decrease formation of dihydrotestosterone. It also being used to treat a benign prostatic hyperplasia and male pattern baldness. For the flutamide, bicalutamide, and also enzalutamide, it acts as a competitive androgen inhibitors at target cell, and it is effective orally for prostate cancer treatment. The clinical usage of the anti-androgen, it can be used for prostate cancer, acne and hirsutism in female, precocious puberty in males. The adverse effect it could be gynecomastia, decreased libido, inhibit of spermatogenesis. Okay, these are the term that has been used with the definition during this topic. Okay, thank you very much. Assalamualaikum warahmatullahi wabarakatuh.